The race to vaccinate continues across the country as the spike in COVID cases driven by the Delta variant keeps affecting unvaccinated people. That includes kids under the age of 12 who can't get the vaccine yet. The last American Academy of Pediatrics report shows the second highest weekly total of COVID cases found in children. We're talking about more than 243,000 sick kids. But there's some good news here. Pfizer just says a lower dose of its vaccine is safe for children aged 5 to 11. While the data still needs to be submitted to the FDA, this could be a big step towards making the vaccine available to young kids. But even if it is, will parents get their kids vaccinated? And will pediatricians recommend that they do? CBS 12 News' Madeline Montgomery joining us live from the Palm Beach Gardens Medical Center to find out. Maddie, what'd you learn?
Parents that I've spoken with are really back and forth on this, even the ones who were gung-ho on going ahead and getting their own shot, and that's because they're worried about the side effects that they could see in their little ones. I spoke with one mother whose daughter Caitlin is in second grade, and for her, she was a little worried about what exactly she was putting in her daughter's body, but at the same time, she wants to stop worrying about her kids' safety. While her daughter's school in Boca Raton hasn't had too many coronavirus cases, she's known enough people to test positive for the virus or had to quarantine because of it that she's just tired of worrying about if her daughter is going to be next.
If I can give her an added level of protection against this, and that will allow her to really go back and, back to a normal life that a kid should have, I'm willing to give it a shot.
Just some extra insight for parents to know. Pfizer tested the vaccine at different doses on younger children. The second shot used on kids 5 to 11 will be a third of the dose that adults get. They may experience side effects like adults and teens have, like headaches and muscle pain and fever, but children will still build up the right amount of antibodies to fight off the virus. The results do seem good for one infectious disease pediatrician at Palm Beach Gardens Medical Center. He says he will definitely be recommending this vaccine.
There's two main benefits. Obviously, trying to keep the spread to a minimum in children, keeping kids out of the hospital and not getting very sick from this, and then not being vectors of spread in the community and spreading to other people.
We've been reporting all year on how long it takes to get a vaccine approved, and this is going to be no different. So Pfizer has put in for the FDA to review and approve of this dose for children, and it could take months for kids to be able to go ahead and get their shot.
The most recent American Academy of Pediatrics report shows we just added the second highest number of childhood COVID cases in a single week since the pandemic began. A spike in cases driven by the Delta variant, which has disproportionately affected the unvaccinated, including children. But today, big news from Pfizer, the pharmaceutical giant, announcing positive results for its COVID-19 vaccine trial among kids ages 5 to 11 years old.
Yeah, Pfizer and BioNTech now working to get their findings into the hands of the FDA, seeking emergency use authorization.
The return of in-person learning this fall came at the height of the highly transmissible Delta variant surge.
The cases in pediatric patients have risen tremendously from when we first seen earlier in the pandemic.
The CDC reporting the spike mainly among unvaccinated kids, who are up to 10 times more likely to end up in the hospital. But hope on the horizon. The Pfizer vaccine may soon be available for kids 5 to 11.
If you can, please consider getting your child vaccinated.
This is going to be a great extra tool for some protection for our kids, some protection for our classrooms, some protection for our teachers.
Tampa Bay General Hospital Dr. Jason Wilson tells CBS 12 News he made sure to vaccinate his own preteen as soon as the shot was available. And as someone who's been on the front lines of the pandemic, he's thrilled for parents of this younger age group. The vaccine requires 2 shots taken 21 days apart. The biggest difference? It's a lower dosage than the fully approved adult shot. So here's what the trial data shows. Pfizer's COVID vaccine is proving to be safe, effective, and robust at creating an immune response in children 5 to 11 years old. Kids are also experiencing similar side effects after getting inoculated, which can include headaches, muscle aches, and fever.
Remember, most things we see when there's a problem with the vaccine, they happen right away. We see that signal right away. We have not seen that signal.
How would you personally ease concerns for any parents?
We have millions and millions of people who've been vaccinated. Wouldn't really expect to see anything different in kids. The data that Pfizer is releasing should just reaffirm all of that to us.
Pfizer is planning to submit its findings to the FDA by the end of this month, which could be reviewed within 30 days. So if all goes smoothly, the vaccine could receive EUA and be available for kids 5 to 11 in time for the holidays.
Public schools in Indian River County are using a new system to determine if children need to be wearing a mask at their school. The superintendent of schools says so far it's working well. CBS 12's Al Peffley joins us in Vero Beach. Al?
Liz, the Indian River County School District has decided to try a new approach when it comes to deciding whether students need to wear masks on campus.
COVID is it's a bad disease right now. It's terrible, and I hate for the kids to have to get it.
Michelle Messina has two granddaughters at Storm Grove Middle School, a 7th grader and an 8th grader. Outside the school, there's a big sign that shows this particular school is in the red category, which means the level of COVID cases here is greater than 5%, and that masks are mandatory unless you have a note from a doctor. Find that a little confusing at all as to uncertainty about what color is the school at and where do we stand?
Well, at first I did, but then I looked online today, and now I kind of understand it.
This drills down is very specific to individual schools, looking at the overall percent at school sites, and then applying the mitigation strategies based on the percents at that school specifically.
It works like this. If a school has less than 1% of COVID cases, it's in the green category and masks are optional. If a school has 1 to 2% of COVID cases, then it falls in the yellow category and masks are recommended but not required. If a school has 3 to 4% of COVID cases, it's ranked in the orange category and masks are highly recommended, but students can opt out with a parent's permission. And again, 5% COVID cases or above, that school is in the red category, and students can only opt out of wearing a mask if they have a note from a doctor. We asked Superintendent Moore if he's worried that lifting the mask requirement at some schools might actually increase the number of infections there.
And you're not worried that in these green or yellow schools, you're going to see a rise in cases?
The second we see a rise in cases, you'll see mitigation strategies to offset that rise.
And the superintendent of schools says it'll be easy for parents to know what category their child's school is in. If they don't drop off their child in the morning and see the sign out front, the information for each school will be updated daily online.